Hello, I'm Joyce O'Shaughnessy. I'm the Celebrating Women's Chair in Breast Cancer Research at Baylor University Medical Center, Texas Oncology, and U.S. Oncology in Dallas, Texas. A very important trial that was orally presented by Nadia Harbeck at San Antonio 2020 is the German ADAPT trial, which is an adjuvant therapy trial in hormone receptor positive, HER2 negative patients who had 0 to 3 positive axillary lymph nodes. And the question in the ADAPT trial, again, is which patients really benefit from chemotherapy and which patients can really benefit from optimal endocrine therapy and can forego chemotherapy without having an adverse effect on their outcome. So the ADAPT trial was a very, very interesting design. Patients could be premenopausal or postmenopausal, estrogen receptor positive, HER2 negative, with 0 to 3 nodes positive. And they underwent a 21 gene recurrence score on their upfront biopsy. If the patients had a recurrence score between 0 to 11, they were treated with endocrine therapy alone. And the German group had previously reported the results from that trial, and those patients did extremely well with endocrine therapy alone with a very low recurrence score of 0 to 11, with approximately a 95% invasive disease-free survival at 5 years. So in this next step on the ADAPT trial, patients whose recurrence score was 12 to 25 were eligible to receive about 2 to 3 weeks of preoperative endocrine therapy, according to the physician's choice, prior to their definitive surgery. And when they went to surgery, if the Ki-67 on the surgical specimen was 10% or less, that was considered an endocrine therapy response. And those patients who had 0 to 3 positive nodes, a recurrence score between 12 and 25, who had an endocrine therapy response with a Ki-67 10% or less in the surgical specimen after just 2 to 3 weeks of endocrine therapy, received endocrine therapy alone, no chemotherapy. And the primary endpoint was invasive disease-free survival in those patients with the recurrence score 12 to 25 and the endocrine therapy response. The goal was for them to have the same invasive disease-free survival as the patients did who had the 0 to 11 recurrence score, which had been previously reported. It was a non-inferiority trial looking for basically equivalence in outcome of this 12 to 25 recurrence score group that had had a good Ki-67 response to preoperative endocrine therapy. And the trial met its primary endpoint. The invasive 5-year disease-free survival in the patients with the recurrence score of 12 to 25 was 92.6%. And in the 0 to 11 group, it was 94%. And that met the pre-specified boundaries for non-inferiority. So the patients did very, very well with endocrine therapy alone. This was true whether the patients were premenopausal or postmenopausal. They did very well without the chemotherapy. This was also true for patients who had node negative breast cancer. They had about a 75% 5-year invasive disease-free survival if they were in the 0 to 11 range or 12 to 25 range. And also the patients with 1 or 2 positive nodes did extremely well with endocrine therapy alone. However, patients in this ADAPT trial who had 3 positive nodes with endocrine therapy alone with the recurrence score 12 to 25, they only had a 76% distant disease-free survival at 5 years. So 0 to 2 positive nodes did well with endocrine therapy alone, provided their Ki-67 had suppressed with preoperative endocrine therapy, but 3 or more positive lymph nodes patients would not be a good candidate for this approach. So this is a very important trial because it suggests that, for example, going back to the RxPonder trial, that if a woman is a premenopausal patient and she's got 1 to 2 positive lymph nodes, and you're not sure that she will benefit from chemotherapy outside of an ovarian function suppression effect, that one could treat her with 3 weeks of preoperative optimal endocrine therapy, let's say an LHRH agonist plus an aromatase inhibitor. And if she had very significant suppression of the Ki-67 to 10% or less, according to the findings of the ADAPT trial, if her recurrence score was between 12 and 25 or 0 to 25, she should do extremely well with endocrine therapy alone. So in Germany, this is a very standard approach now to patients with 0 to 3 positive lymph nodes. They don't know for sure how many lymph nodes they have until they have definitive surgery. But if they have clinically positive nodes or clinically negative nodes, if the recurrence score is between 12 and 25, they receive preoperative endocrine therapy. And if the Ki-67 suppresses and they have only at surgery 0, 1, or 2 positive nodes, they are offered endocrine therapy alone without adjuvant chemotherapy, regardless of menopausal status, provided they receive optimal endocrine therapy. So these are very exciting results, and I think it's something for us to know about and consider, particularly in patients that we're not 100% sure that it is safe for them not to get chemotherapy, utilizing some preoperative endocrine therapy and then looking at the Ki-67. If they have a low node burden or node negative and a recurrence score 0 to 25, maybe additional support for the patient being able to forego chemotherapy and just be treated with optimal endocrine therapy alone.